Culture Care Connect is a Aboriginal and Torres Strait Islander community control led program focusing on suicide prevention and aftercare. Social and emotional wellbeing is a really important concept to consider when working with Aboriginal and Torres Strait Islander health. Yeah, it considers the different things that impact someone's life, and that could include political and historical context as well.
The way I see it, Culture Care Connect is one part of the machinery. We have programs that are now covering the whole of the lifespan. I think if we can make a difference back here in these early years, then we'll see the change later on in life.
It's quite important to hear other people's journeys, also their stories, but also how we can help and support each other to looking at ways to seamless kind of process. And it's quite important to feel valued and role model as myself in the community space to have a conversation and make it more seamless kind of process, make it more culturally kind of appropriate to helping people on the same level with some more culture aspects and maybe how to go grief and loss and how you feel anxiety or depression or in the process. So we really simplify and really break it down on the people's levels, you know what I mean? So
what's unique about the program is that it's completely community controlled. So this is the first time services are being provided directly through ACCHOs, and ACCHOs are provided with flexible funding to design their suicide prevention plans to the unique needs of their community. We've sort of provided resources and supports to ACCHOs, which sort of provide this kind of framework around suicide prevention. They can tailor those to the needs of the community. So what we're sort of finding is that each location has very different plans and different kind of service connection as well.
If the client's not wanting the clinical side of it and being sent to the hospital and just being a number, then we have that service available to them where they are person and they are treated in a cultural appropriate way.
Having an Indigenous worker there will open up those doorways for them to be able to come and see us. Be able to talk their language, put it in a way that they can understand, rather than having all these big medical terms that they hear from different clinical places and that sort of thing.
It's a thing that family, with all families, when someone says suicide, they want to know why. They say, well, I seen him yesterday. I'm saying that, where did he come? Don't let come to me. You know, I'm here all the time. See, what I do when I see my clients, I give them a take. You what? I give them a cuddle. I think when I leave, I give them a cuddle.
And we started to think that we can have a role in that and a part to play in the community and to let them know that they're not on their own, and to just be able to put it in a context that they can understand.
I think my goal for the future would be to see this program continue. I think it needs to be given more of an opportunity because suicide will never go away, it's always there.
How do we gear up our community with the tools and resources, those people within family networks or those certain key people within our communities to be able to look for the sign? If we don't have programs or services such as these, we're not going to get the opportunity to be able to make the change.